Hi everyone, I am Mr. Lee. Today I am going to talk about the anatomy of the teeth and the treatment modalities for the diseases of the teeth. So first of all, what we can see here is a typical molar. So for a teeth, they have three layers. The first layer, which is the white layer, is known as the enamel. Next, the yellow layer is known as the dentine, and then the red layer is known as the pulp space and root canal. So the pulp and the root canal are where the blood vessels and nerve run within the tooth. The tooth is divided into two layers by the gum, into crown and root. The tooth is supported by two supporting structures known as the periodontium, which consists of the alveolar bone, the gum, cementum, connective tissues, and some ligaments. Next, I'm going to talk about dental caries. So caries is essentially a disease caused by the metabolic end product of bacteria, which is acid that cause dissolution of inorganic components of the tooth. So first of all, we have a clinically normal tooth in which it is infection free and there's no cavities on the tooth structure. Next, when the tooth is infected by bacteria, the bacteria will release acid that cause demineralization of the tooth structure. So when it's only restricted to the enamel, it is known as the enamel caries. However, if the enamel caries is left untreated, it may progress even deeper into the dentine, which is called dentinal caries. So for enamel and dentinal caries, they are treated by two options. One is by chair-side filling. One is known as the indirect restoration. So for a chair-side filling, the dentists have to remove the infected tooth structures and replace the lost tooth structures with a simple filling. However, if the cavity is too large, the dentist may indicate a crown restoration to restore lost tooth structure. For caries that are left untreated, and it may progress into the pulp space. This is where the patient may feel sharp, spontaneous pain that radiates to the head. The patient may also be awakened from sleep due to toothache. So these are the symptoms of irreversible pulpitis. So for irreversible pulpitis, the patient needs to receive root canal treatment. So this is a simple illustration of a root canal treatment procedure. First off, we have an infected teeth in which there is presence of tooth decay and as abscess. So the dentist will remove some tooth structure and create an opening to allow its entrance of instruments into the pulp canal and space. Using specialized instruments known as the endodontic files or chemical agents such as the sodium hypochlorite, the dentist will remove all the infected tissues and clean the canals. Next, the dentist will fill the empty root canals with gutta percha, also known as the root filling. Lastly, the dentist will restore the lost tooth structure depending on the size of the cavity, with either chair-side filling or indirect restoration such as crown. So this is a simple introduction to the anatomy of the teeth and the treatment modalities for dental caries. I hope you all benefit from this video. I'll see you guys again. Thank you.